All right, all in favor say aye. Aye.
Aye.
All opposed, nay. Okay, the minutes are approved. Thank you. So I would like to acknowledge the great service that our SAC members have made and acknowledge that it is time for some of our members to finish their terms. So a couple of them have actually moved on to become board members. Yvette and Joanne are now members of the MHBE board, and Zach left because Aetna was leaving the market. So I want to thank them for their service. And then also, this is the last meeting for Mukta Bain, Marquetta Carey, Evelyn Johnson, Carmen Larson, Douglas Spots, and Rick Weldon as well. And I want to thank each of you for the unique perspective that you have brought to this committee. You have strengthened the foundation of this committee for years to come and truly have made a difference protecting and expanding access to health coverage. So thank you for your important contributions. And then I also want to thank Mark. This is his last meeting as co-chair. And Mark, as you conclude your term as co-chair, I'd like to thank you for your leadership and expertise helping move Maryland closer to achieving quality, affordable healthcare for all. As a mostly solitary co-chair, especially thank you for your leadership. You helped guide important decisions, foster thoughtful discussion, and ensure that members have felt heard and valued. So I want to thank you very much, Mark, for your outstanding service.
Thanks so much, Stephanie, and thanks to everyone on the SAC. It's been great serving, and I've learned so much from participating in these meetings. And so yeah, thank you all. So I can take over and sort of run the rest of the meeting here. So yeah, we have a lot on the agenda. We'll have an executive update. We'll go over plan certification standards. We'll discuss the small business enrollment portal updates, as well as upcoming consumer and stakeholder events. The MIA Health Coverage Assistance Team will give an update as well. And we'll also talk about upcoming federal changes. So there's a lot of different items here, and we'll try to leave enough time to discuss all of them. So I think we'll start with Johanna.
That's right. Yes, I'm standing in for Michelle, who couldn't make it today. I'm joining from the National Association of Medicaid Directors Conference, so apologies for any background chatter and folks walking by in the hotel lobby here, and on my phone because of Wi-Fi issues. Hopefully it all works out. So yes, Michelle's apologies for not being here. I also want to echo everything Stephanie and Mark said around thanking all of our members who are completing their terms for their service. It's really helps us, and we so appreciate everyone's input on the safety and the service for the exciting forms. All right, so some updates on the federal front. So we all know that shutdown concluded without reaching a deal around extension of the enhanced premium tax credits that are expiring at the end of the year. We remain keenly interested in what Congress might do. I think we would think hope that a deal to extend the tax credits will take shape, but the Senate is supposed to hold a vote starting in December, so we'll see what happens from there. But obviously, time is very, very much short. So we're paying attention. We stand ready to update Rail Health Connection with adjusted premium tax credit calculations if Congress reaches a deal. Been sort of the same message for all of 2025. We're just watching what Congress can do. You may have read in the news or heard that the White House, the administration, has been talking about some different ideas of preferencing tax credits, like funding HSAs or otherwise giving folks money directly to spend on their health insurance. Very hard to imagine how that would take shape, particularly in a quick time frame. So hoping that if Congress does decide to take action, it will be a clean extension of the enhanced premium tax credits or something pretty close to what we have in 2025 so that we can implement it quickly. 2026 shaping up to continue to be an exciting ride for the health markets. So switching gears to open enrollment, we're on day 20 of our open enrollment, and it is in full swing, regardless of what's going on in Washington. Our new enrollments are about 13% below where they were at this point year over year. Our total enrollments are up about, let me double check this figure, are up about 10%, I believe, but that's including folks who will be losing premium tax credit assistance next year if no deal is struck. And so I think it's going to take a little bit longer than normal in 2026 to see what our enrollment numbers really shake out, because people will be making decisions into the early into the year as they, may decline to pay that first bill or choose to terminate coverage when they clue into what their renewed premium is. However, we do have our state premium subsidy, and we are hearing from consumers that they're pleasantly surprised by the increase in that and how it's continuing to support affordability. So yes, we are, unsurprisingly running a little bit lower year over year, but still out there serving consumers and not experiencing any major hiccups in the open enrollment process. The last update area I'll highlight is the AHEAD model, which is the Maryland and federal agreement that provides the framework for Maryland's healthcare model and how the state police hospitals in particular. So that will kick off in 2026. It was the new agreement was signed November 12th, and it covers the next 10 years. There's been a lot of negotiation that the HSCRC and Department of Health have been leading, lots of stakeholders. So it was a big accomplishment to get that signed a couple weeks ago. And MHBE is participating in a working group of state regulatory agencies who are kind of working towards how we realize and make tangible what we've committed to under the AHEAD model. A couple of elements that will particularly affect the private market overall, including the individual and small group markets, include some commitments under the model to set targets for how much carriers and payers overall spend on primary care, with the goal of boosting the primary care investment across payers in the state, as well as implementing a total cost of care growth target for the state to align cost growth across payers as well, including the commercial market. So looking forward to engaging on those. Those are both still have months and months of policy development, including engagement for those targets each state. In the shorter term, the HSCRC has been leading some listening sessions that were held in October and early November around policies for Medicare Advantage stabilization and some cost shifting related to hospital costs across market sectors. So I know they gathered a lot of really good feedback through those listening sessions, and the group is working to put together kind of a summary of that and a proposal for public comment. So that's my update. Happy to take any questions.
Thank you. Are there any questions from any of the SAC members?
I was wondering if the federal government did do something to enhance their tax credits in December. Do we know if there's any federal flexibility to extend open enrollment, or I guess that would just be part of the deal that they would make?
So currently, for this current open enrollment, state marketplaces have flexibility around their open enrollment dates. So it's our board's decision what those dates are, and they could extend them. That's definitely a conversations we've had internally, that if the deal takes shape, I think that'll be very much on the table given the consumer confusion that's likely to result from it. Starting next year in 2026 for 2027 coverage, state marketplaces no longer have that same flexibility to set open enrollment dates. So our hands would be much more tied if it were a year hence, but this year we still have that flexibility.
Thank you.
Any other questions on the executive update? Lots of moving parts. I have questions about what this HSA plan would look like, but I don't know if anyone has the answers just yet. So.
Right. So they haven't really, not all the hospitals have signed up to it yet, right? Are we waiting for all the hospitals in Maryland to sign up to this new plan? Or is one of the ones that it's like you either sign or you're just not going to be involved anymore or something like that? Because they say it's voluntary, but I think it's, what I heard is it's voluntary, but you have to sign up to it anyhow.
I think I am not the expert. I know the hospitals do have to sign participation agreements. I am not up to speed on what the deadline for that is. And I think there are strong incentives to participate. But yeah, definitely not the expert on that.
Right. Okay, that's what I heard. And do you think this is going to be overall a hardship for our hospitals who are already having a hard time with coverage, or do you think this is going to make it the same or better, or do you think it's just going to be more difficult to cover along with all the other things that are happening in policy?
Yeah, I'm really not the expert on the hospital portion of. There's more of the tangential elements that I mentioned that affect the commercial market payers that I'm a little more up to speed on. My understanding, however, is that there's relatively minor changes to the existing model structure for 2026 and 2027. And the new ahead model, although it's in place starting in 2026, changes will be more significant forward. But I think for 26 and 27, the changes aren't too significant.
Okay, I just have one last question. It's not directly related, but kind of something we've been dealing with the policy of deportation. When the children of people who are we have households where one of the parents is deported and the other is not, and stays with the children. And is it true that the children cannot be, even though they're U.S. citizens, they cannot be covered by health insurance if the parent is not a citizen?
That is not true. Citizen children are eligible for coverage through the marketplace regardless of the immigration status of their parents. Parents can enroll them. They'll wind up in Medicaid, CHIP, or private coverage depending on household income. And the parents do not have to provide information relating to their immigration status as long as they're not trying to enroll in coverage.
But that's through the portal, right? So I mean, a lot of what I've heard is not necessarily through the portal. It's just that they were trying to get coverage for their children and they couldn't get it if they were not themselves citizens. But you're saying that if they went to the portal, they don't have to give their social security number. They just give their children's social security number, even though they're minor children.
That's correct. The parents don't have to provide an SSN or an ITIN or any immigration status for verification to enroll. That's their
Okay, thank you.
Okay, well, great. Thank you for the questions and thank you for the update. So I think next we'll go to Becca Lane to discuss value plans.
Thanks, Mark. Hi, everyone. So yeah, I'm here to talk about our value plans for 2027. So far, this is all we have in the way of plan certification standards for 2027. So for those of you who don't know, our value plans are plans where each carrier is required to carry them at each of the bronze, silver, and gold medal levels. And the benefit for that is, so then between all the carriers, the cost sharing is the same, no matter who the carrier is. These plans, the value plans have the same benefit structure. So the goals for these plans are one, they have a lot of pre-deductible coverage. We design them that way. And then the second benefit is theoretically for consumers to be able to more easily compare plans with an apples to apples comparison, and all someone would have to do is pick the carrier that they like the best. So every year we convene a work group to help us figure out how to design these plans for the upcoming plan year. So we just wrapped up the kind of main portion of our work group for the 2027 plans. But I'll talk more about next steps later. But so far the work group has recommended the draft plan standards for 2027. And so back in 2020, for 2024 plans, we did a big overhaul of the value plan. So since then, we haven't done much changing of the kind of baseline cost sharing. So same is true going into 2027. The group is recommending that we keep the cost sharing the same that it was in 2026. And that's, of course, subject to the actuarial value calculator for 2027. So basically, we have to make sure that the plans fall within federal restrictions on generosity. So we won't have the kind of measurement tool for that until later this year. So we'll reevaluate at that time. But so far, the recommendation is to keep the cost sharing consistent as much as possible. And then another feature of the value plans is that they have enhanced kind of diabetes coverage. So diabetes is a statewide health goal, improving diabetes outcomes and costs associated with diabetes. So in the value plans, there's always been, or for a long time, there's been a component of lower cost diabetes care, but each year we kind of improve and increase the care that is available for diabetes at $0. So previously it was, regular glucometers, insulin, test strips, and a suite of services that kind of go into managing diabetes for a year, like certain labs and like podiatry, that kind of thing. But then for 2027, the work group is recommending that a continuous glucose monitor, not just the regular kind of finger prick one, be available in all the value plans at $0 cost sharing to the consumer. So to go along with that requirement, the group also recommends some kind of transparency efforts. So one recommendation is that the carriers have a dedicated page on their websites with information on the CGM coverage and also all the other diabetes coverage, just telling consumers how they can access these benefits that they're entitled to, and giving information about that. And then there are also things that the group recommends that we at MHBE do. So one of those things is to add more information on value plans and on diabetes coverage in the value plan to our plan compare tool in the plan shopping page. Also to conduct consumer testing on the value plan name and possible alternatives to it, because we hear that value plan doesn't have the best connotations. It's not really encouraging people to pick those plans because it sounds like it's not as good somehow, like it's a discount plan, bargain basement plan. So they've recommended we look into that. And then lastly, the group recommends that we collect some data from carriers on the utilization of the diabetes benefit in the value plan and any kind of denial related to those benefits, and then comparing that to also non-value plans as well, just so that we can keep better tabs on. We're doing a number of different things to try and evaluate how consumers are accessing their diabetes benefits in the value plans, but we just want to do as much as possible. So this last recommendation is around that. So those, yeah, this slide, this is all the recommendations from 2027 group so far, but next step, like I said, we don't have kind of the federal requirement for plan generosity yet, so we're waiting for those to come out. And then when they do, we'll reconvene the group again if it looks like we're going to need to make any changes to comply, and then we'll bring the draft design to the board during the kind of the plan certification standards presentation to the board in the spring. That's all I have on that. Let me know if you have any questions. Thanks.
Thank you, Becca. Are there any questions on these recommendations?
So Mark, not a question, this is Rick, but just an observation. I received my secondary carrier is Care First. I received an email today to enroll in their free CGM. I am a type 2 insulin dependent diabetic, and I received an email from Care First Outreach today to sign up for my free CGM and coaching service.
That's really interesting. That would be, that's great. Yeah. That's even separate from our value plan. So that's really cool to hear that Care First is doing this. Thanks for sharing, Rick.
Any other questions or comments for Becca?
Great job, Becca.
Thanks.
Thanks.
All right, Amelia, what is next? Yeah, we've got the we'll have the update on small business, the small business portal. Thanks. From Makeda or Mimi. Sorry, thank you.
No worries. Hi, everyone. Thank you for having me here again to sort of provide an update on MHC for small business, especially since our portal just launched. Next slide, please. Thank you. So just to give you guys a brief history of where we were and where we are now, our Maryland Health Connection for Small Business launched in 2014, and it's offered, it's the ACA's shop marketplace that's known as SHOP, but we go by Maryland Health Connection for Small Business. And it offers, it's offered to help small businesses offer client health coverage. And the goal has always been to simplify access, improve choice, and support small employers who want to offer competitive benefits. By 2018, we shifted to the direct to carrier enrollment model as a temporary measure. And in 2019, we rebranded from Federal Shop to MHC for Small Business. And we envisioned an integrated enrollment portal for 2020. And then in September 2025, just a few months ago, we launched the enhanced enrollment platform that operates as a reliable, simplified platform with ongoing improvements focused on usability, accuracy, and consistent enrollment experience. All right, next slide, please. So roughly 1/3 of uninsured Marylanders work for small businesses, and that's a major gap, and especially when you consider that these are often hardworking employees in essential roles. And the DC metro area is, in Maryland specifically, has highly educated workforce, diverse industries, from biotech to cybersecurity, and a strong state support system that already help thousands of businesses thrive. So next slide, please. The advantages to offering small group plans through MHC for small business are employees or eligible employers may qualify for a tax credit of up to 50% of their premium contribution towards the employee-only premiums. The offering of health insurance helps, small businesses attract and retain top talent. Brokers are available at no cost to employers, and they are able to compare plans, understand their options, and complete their enrollment. All plans are offered through MHC for Small Business are Affordable Care Act compliant. Next slide, please. So this is the user feedback we've been getting on our new tool. And what we're hearing is from small employers is that it's a very easy, seamless process for them to set up a benefit package for their employees. And one broker gave us a statement, and he said the Maryland Health Connection has invested in a brand new online program to enroll small businesses in affordable health programs. This new program is in effect now, and I salute Maryland Health Connection as an authorized broker for a job well done. And that's one of our top brokers. His name is Eugene Poole. And so we appreciate the feedback from users and brokers and everyone that's been on our system. All right, next slide, please. So the enrollment projections we're seeing so far, and we're in Q4, which is peak season for everyone, whether it's the individual marketplace or the small group marketplace. And I added this February, which really rolls into Q1 for next year, just to kind of give you guys a snapshot of what enrollment looks like. And just at a high level, we were in our soft launch phase from September until about mid-November. So we didn't get any new groups during that time. And for December, however, we were able to migrate several groups into our platform because we were already enrolled. And we have 4 new groups for December, which is exciting with a total covered lives of 28. So when we're looking at all migrated groups along with the new groups, that is a nice increase for December. And then for January, we have a lot of groups to migrate, and we're in the process of migrating 30 groups with 152 covered lives. And in the pipeline, we have about 10 new groups with 20 covered lives. And what we're seeing is, overall, we're looking at about 20 to 30% increase from where we were last year at this time. So it's gradually increasing, and it's great news, and we're seeing improvement in our numbers and overall numbers. And as you can see in February, as a snapshot, we have 16 existing groups that are on their way to migrating. And we have about 1 group so far in the pipeline. I believe that's updated to 2 new groups in the pipeline. So if all of these come together and actually end up enrolling in the platform and finalizing their benefit package, we're looking at, like I said, about 20 to 30% increase overall. All right, next slide. So speaking of brokers, as I said earlier, we had a statement for brokers. They're our main drivers in how enrollment happens. As you know, on the individual side, there are navigators, consumer assisters, there are different resources that assist consumers in enrollment. But in the small group market, we only have the brokers. And if the employer is able to do it themselves, they will be on their own trying to figure out the compliance aspects. And so we try to drive businesses to tango with a broker, meaning, connect with an authorized MHBE broker. And so we're seeing there's about 70 brokers out there that have about 1 to 2 groups out of the total 112 unique businesses that we're seeing come in the pipeline. And our top 10 brokers tend to submit about 3 to 5 groups. And so it accounts for about 41 groups, and which is roughly about 20% of the total volume. All right, next slide, please. Our outreach and education program is we've talked about this some time back, and Teresa has also touched on this some time back as well. It's basically where we're having employers come in and watch 2 7-minute videos, schedule a presentation with a broker. And this is, again, one way for us to partner with these brokers because we know they're the main drivers of businesses coming in through the portal. And then if the business signs up for coverage, they get a seal that says, you know, they offer health insurance. And this came out, and Stephanie, I know you recall this from the work group we had back in 2022, and it came out to us as a recommendation from that work group that, you know, we provide a seal for businesses that offer health insurance in lieu of that subsidy that we had a work group for. So this program has also launched in September, and we're hoping that, you know, starts to gain traction. I know about 2 groups so far. A broker has tried to put through the program. And so we'll see how it goes. And maybe at the next update, I'll have a little bit more information about the success of that program. All right, next slide, please. I think I should be towards the end. Yeah, so one of the ways we try to update or try to complement the offering is, you know, we're trying to improve on what we already have. And what we've seen and heard from employers and brokers is how limited plan selections does not work for the small group market. So Amelia is working on changing those regs for us, and it's under review, and the regs are going to be updated from allowing 4 plans per middle tier to 8 with our small group or small business carriers on the portal. And so it's under review with legal, and it will be posted soon for public comment. Next slide. I think this should be my last slide here. So as I said, we've listened and we built a tool that's designed for the real world, shaped by the needs of the Maryland's small businesses and our broker partners and employees. And we're closely monitoring the developments around ICRAs, which are individual coverage health reimbursement arrangements. They're taking a lot of traction as a meaningful alternative offering for small businesses to allow their employees to get coverage through on their own on the individual marketplace. So we're committed to also ongoing improvements to the new portal, allowing you to stay intuitive, efficient, and responsive to user needs. And we're also always open to new ideas to enhance the program. So we're listening to the brokers and businesses to see what we could do to improve access for underserved businesses. And so I just thank you all for listening, and I look forward to showing you more in the coming weeks and months. And it's a growing, you know, platform and program. So thank you all for your time today. Any questions for me?
I have a few questions. I feel like I'm curious if you like are you tracking it all, or have a sense of like how many of the, you know, the small businesses signing up now are, you know, new to offering coverage, or are they sort of just changing from, you know, going off exchange now to coming on exchange, or, you know, they're new businesses, you know, making this decision for the first time? Are those things being tracked?
We don't have an official tracking system, but I know our data manager here, Pooja, is working on a dashboard, and so that will be something that we will incorporate on that dashboard. But right now we're looking forward to just seeing how many new businesses are coming in. So we will know how many are new to MHC. We just don't know which ones had coverage off exchange. We're not collecting a response like that from users.
And I was interested to hear more about like this, the question around ICRAs. Like, do the portals speak to each other at all? Like, can employers think about like how much a plan for their employees on the individual market might cost versus, you know, a small group plan? Is the goal, I guess, to work towards something like that, or?
Yeah, that's a very interesting question because we did get a demo from Connecticut and their system does do something like that. And we were trying to build a similar platform down the line for FY, I believe 27, but no promises yet. But yes, so their platform definitely calculates affordability and we were able to see, you know, what this plan would cost the employer based on their budget, on the individual if all of their employees went on the individual exchange using the ICRA contribution versus a small group plan. So that was definitely a very nice demo to see. And we're hoping to build something similar.
Cool. Thank you.
Thank you. Nice questions. So I appreciate that.
Are there other questions for Mimi?
I guess I also am interested in the future, knowing if it's businesses new to offering coverage or businesses that already offered coverage, but see a new value in the new portal that are coming in. So I think kind of knowing that would also help if we're spreading the word about it. Know like what have people been finding the most attractive based on their own needs, and just how to pitch it to people. And congratulations on the launch, by the way. That's really exciting. And I know it's been a long time coming and a lot of hard work going into it.
Yes, and you've been involved every step of the way, Stephanie, with different stakeholder groups. So thank you for your involvement with this too. And that's a great question about, you know, what users are seeing and what each person, you know, we've talked to many groups, whether they're new to MHC for small business or where there are existing groups migrating over to this new platform. And we're hearing different things that they love about it. One is, oh, this is so simple. I wish, you know, the other TPA I was working with had a system like this. Or, you know, our customer service, sometimes we're giving them concierge, you know, hand holding as they're migrating over to this platform. And we're, you know, and they're saying, I don't get this elsewhere. So thank you for helping me with this. So it's different things that people look for and that we're meeting. And, you know, we just had a soft launch a couple months ago and we're just now in the official, you know, launch. And, you know, there are some technical difficulties, but it's how we are addressing them and how we're staying ahead of those and fixing them. And people appreciate that too. So I'm hearing different things, like I said, and it's all positive. So we're very fortunate for that. Hey, Allison.
Hello, Allison from Kaiser Permanente. Just wanted to also add to Stephanie's comment and say that, you know, this is an extraordinary amount of work on the part of the exchange and just wanted to congratulate you all. Like, we're really excited about this platform. It's going very well and also eager to understand more around kind of the data and who's coming into the platform. So look forward to the work that Pooja is working on and appreciate the data shared in this presentation as well.
Thank you, Allison. Yes, data will be coming very soon. Yes, so, but thank you. I don't want to take any more time. And I know we have some other presentations coming up. So thank you, everyone. I hope to come back soon.
Thank you. Yeah, and I just want to echo what Stephanie and Allison said. This is a, you know, major achievement. I'm excited to see, future reporting as well. It's very exciting. Can we move to the next slide, Amelia? Okay, so next we'll have upcoming consumer and stakeholder events from Teresa.
Yes, hi, good afternoon, everyone. My name is Teresa Battaglia, and I'm the Deputy Director of Marketing. Thank you for this opportunity to present today. I'm really excited about talking about the consumer and stakeholder events that we have in marketing. You can go to the next slide. Just to give you a snapshot of some of the things that we've been doing, we've had quite a few upcoming webinars lined up for our consumers. We're constantly reaching out to our consumers to let them know that we're here for them, to help them to enroll, to get health insurance through Maryland Health Connection. And we're working very closely with Department of Labor with a health care for job seekers webinar that is coming up December the 4th. Also in January, all throughout the month of January through February, we are going to have as a follow-up from open enrollment, how to use your health care, hosted by the Maryland Insurance Administration, one of our great partners, in English and in Spanish. So we're really looking forward to those types of webinars where we can help people now that they have health insurance. This is what you need to do. You need to set up an appointment with your doctor. You need to make sure you have all your prescriptions, any medications that you need, and how to use your health care. So that's really important that now that they have health insurance, they know how to use health insurance. One thing I did want to add is that we're currently offering virtual enrollments to consumers. And this is a pilot program that marketing just started this year, and it's been very successful. Our virtual enrollments include some of the top brokers that we have celebrated over the years. We have a Broker Achievement Award event where we recognize and thank the top brokers for their outstanding and dedication and outstanding work during open enrollment and enrolling our consumers in the markets of individuals, small business, the broker assistance transfer phone, which is also known as the BAT phone, as well as a new broker. We celebrate the new broker with high enrollment. So I wanted to bring that in because our brokers are a big part of this virtual enrollment. So we've had 2 to date. We've had a lot of people come on board. We also go through a triage to make sure if they need direction for Medicaid, we send them over to the Maryland Department of Health, or their local health department, I should say. And if they qualify for QHP, they come to us, and we just send them directly to a breakout room with a broker. So that's been very successful. We've also gotten some feedback from consumers saying, this took me an hour. I'm so happy I was able to go directly to a broker to get my questions asked and to enroll. So we're going to be planning more of those events. We're sharing that information on social media. We're inviting people to join, get any questions that they might have answered. And that's also one of our big consumer outreach and education that we're helping with moving forward. So you can go to the next slide, please. We are planning our Broker Achievement Awards for 2026 already, and we have some very exciting news. As I mentioned, we always celebrate the top 100 brokers who go above and beyond in working with consumers, enrolling families, working with small businesses, getting their employees health insurance. And we've already started planning for that this year. In the past, we've been very honored and appreciative to Maryland Insurance Administration. They've sponsored our Broker Achievement Awards, but this year we're able to open up sponsorships to any organization who's interested in coming to the event, supporting our brokers, and meeting with state leaders. So we're really excited about this opportunity. You can go to the next slide, please. And then, of course, for our organizations that are interested, why sponsoring? We highlight the top brokers. We thank them for all their efforts during open enrollment. There's brand visibility for our organizations that are interested in sponsoring, networking opportunities, social media. There's a list of different levels that they can sponsor. So they really, and it shows their support for Maryland Health Benefit Exchange, as well as our broker community. So we're very appreciative about that. And we're sponsorship, anybody who wants to, any organization that's interested, they're welcome to go to our stakeholder website, which is marylandhbe.com, and check out our website, because on there you'll be able to see all the sponsorship levels that we have. And we have a variety of different levels that organizations can certainly look at and get in touch with me. I'm the contact person. So if they're interested in sponsoring this event, which we're really excited about, we would love to have organizations sponsor. But another, I guess, in addition to that, not only will the money go to this event, but it allows us to provide outreach and education for other events for our consumers. So any of the funds that come through for sponsorship that remain, we're able to put towards like a MHC for Small Business Expo. where we're going to invite businesses to come meet with other state agencies and stakeholders and get information, collect resources and those types of things. And we would be presenting. So we have a lot of great ideas lined up for the next couple of months. We're really excited about the Broker Achievement Awards. And we're excited to work not only with our brokers who, and thank our brokers who are the backbone of getting people enrolled in health insurance through Maryland Health Connection, but we're also really excited to work with our consumers as well and help them get the health insurance that they need. And I believe that that's probably the end of my slide, unless there's one more. Oh, those are some of the benefits of sponsoring. So you can go to our website, MarylandHBE.com, and that's our stakeholder website. If you go, you'll see a link that goes directly to, and we're encouraging organizations, if they'd like to support, to get in touch with me.
Great. Thanks so much, Teresa. Any questions for
You're
Teresa?
welcome. Yes, Jose?
No, I just posted the link that you mentioned on the chat. Just in case.
Oh, okay. Thank you for doing that. The website.
Mhm. Yep.
Thank you very much. Okay. Thank you so much for allowing me this opportunity.
Thanks so much. Okay, so I think we'll have the coverage assistant team and consumer notices updates from, I believe, Patricia will be giving this update.
Thanks, Mark. My name is Patty Darn. I am the Associate Commissioner of Consumer Education and Advocacy at the Maryland Insurance Administration. I'm going to talk a little bit about our health coverage assistance team, known as HCAT today, and then I'm going to talk a little bit about some of the consumer notices that we have put out in the past few weeks. Next slide. So just FYI, just so everyone knows, the Maryland Insurance Administration, we are the regulator. We license the insurance companies. We license the insurance producers. We're the ones who examine the business practices of licensees to ensure compliance. We monitor the solvency of the insurers who operate in the state of Maryland. We review and approve those policy forms, review rates, and we can investigate consumer and provider complaints and fraud allegations. Next slide. So the types of insurance MIA regulates. MIA regulates about 34.5% of commercial health insurance coverage in Maryland and about 20% of all health coverage. That's going to be these individual and employer-based plans that are underwritten by an insurance carrier, like those that are offered on the Maryland Health Connection. So the individual and group health plans bought through the Maryland Health Connection. We also regulate the Medicare supplement plans and certain underwritten products that are limited in scope, such as long-term care, vision, dental, catastrophic, etc. We do not regulate medical assistance, Medicare Parts A and B, or the Medicare HMOs, the self-funded or self-insured plans, VA, TRICARE, and commercial insurance coverage issued outside of the state of Maryland. So just an FYI, as I go into what HCAT is, I think it's important to define what falls under the jurisdiction of the Maryland Insurance Administration. Next slide. And so in my group, Consumer Education and Advocacy, we are responsible for consumer education. We are out there at community events, the fairs, libraries. We are meeting people out in the field face-to-face, as well as we do online presentations, webinars, and we publish a lot of informational materials, brochures, etc., and some of the consumer advisories that I'm going to touch on in a minute. But I do want to make sure that everyone is aware of a relatively new program that we have called the Health Coverage Assistance Team, or HCAT, which is right now a team of about 10. And where regulation and jurisdiction with regards to health insurance is complicated. The HCAT team lives under the umbrella of the Maryland Insurance Administration. and is a no wrong door program. Obviously, we can only make determinations over the issues that we have jurisdiction over, but this team operates as a no wrong door. It's not easy for consumers to understand who regulates their health insurance. It's, they're going to come to the Maryland Insurance Administration because we say we're the regulator. How is this the wrong door? I have health insurance. And so that's why HCAT exists as a no wrong door. We're going to provide somebody who comes to us, that is anyone who gets any kind of insurance or the uninsured, and we're going to give them one-on-one help to help them answer the questions and concerns for any type of health insurance. And we are going to walk with them to, if we're not the right location, we're going to stick with them. And if they want us to, we're going to stay with them until they get their answers and their issues resolved with whoever it is that they need to be with. Be that the Department of Labor, be that oftentimes SHIP, the Senior Health Insurance Program. We have a memorandum of understanding with that group. To pass cases, back and forth. Obviously, sometimes it does fall under the jurisdiction of us. More often than not, it needs to, if it's Medicare related, it does need to be with SHIP. And so this team is there to make sure that consumers are not frustrated when they end up at the Maryland Insurance Administration and we don't necessarily have jurisdiction over their policy. Organizations that help consumers can use us too. We have all kinds of materials that we have come up with to hopefully make insurance issues and regulation issues easier for the organizations that help consumers as well as consumers themselves. Next slide. Okay, so, definitely feel free to ask questions about HCAT if you have any. We have been busy on the consumer advisory, consumer notices side lately. That's just because, as everyone knows, there's a lot coming at us from all directions. So I just wanted to bring to your attention some of the consumer advisories that we've put out just recently. This first one, and we did get some assistance from MHBE on this, and I very much appreciate that. It's a fake health insurance sites target shoppers during open enrollment. So this goes through reminding consumers to check that URL, make sure that they're at a .gov, and it's repeated several times in this consumer advisory. So that's kind of our step one. Make sure you're in the right spot, and it also has information about where you can go to confirm that you are working with a licensed agent and broker. It also goes into some detail about some of the other health insurance options outside of the Maryland Health Connection that consumers may find themselves thinking that they might be interested in. And it starts out talking about those limited benefit plans. So health insurance products that are legal, that are regulated by the Maryland Insurance Administration, but that are not comprehensive health insurance. And so we talk about those. We also talk about the health expense sharing platform called Crowd Health, which is essentially a platform where consumers can buy into this at about, I think it's about $50 a month. And in certain situations, they can get a certain amount of healthcare covered. Some of it is covered, and for the most part, they ask to see if they can receive crowdfunding. And so it is a crowdfunding site that's getting a lot of attention lately, and then we want Marylanders to understand, this is what this really is, and there is no guarantee of any health coverage when you sign up for something like a crowdfunding site or some of these other religious publication arrangements that operate in a similar manner, but have a religious component to it, which crowdfunding doesn't. Crowdfunding is actually a for-profit entity. So this consumer advisory goes into those details, and it also talks about unauthorized health insurance plans. So plans that are not authorized to be sold in the state of Maryland. We also put out recently a consumer advisory about Medicare open enrollment, going into some details about specifically some of those changes that have happened this year, which I'm sure everyone has heard a lot about. There's a lot of concern with the Medicare Advantage plans in particular this year. And I just want to say, like, because Amelia, did you have a question? Because you just turned on your camera. Okay.
I did not. Go ahead.
Okay. So, all right. So we go into detail with regards to the changes for the Medicare Advantage plan. So that's another one that we've just put out in the past couple weeks. And then we had one that we just put out yesterday, which talks to consumers. It's more about the Medicare Advantage plans, those consumers who are in a Medicare Advantage plan in 2025, and it's not going to be available in 2026. So it goes into the details of what their options are going forward. And then in production right now and hopefully posting next week, we are getting more questions and concerns, and in particular with regards to the Gov IQ questions, inquiries that are sent over to us regarding consumers believing that there are no tax credits available, as opposed to, just that not understanding that the whole story with regards to the enhanced tax credits are still available. And so we are working on and will publish next week a consumer advisory that hopefully explains this in a simple way that we can all get out there in front of consumers so they understand it's not all gone, and it points them to the reality of the situation. So I think the next slide is just the HCAT contact information. That's our HCAT contact information. So email, phone, and then we also have a web form as well. And I am happy to take questions at this point. Carmen? Oh, thanks, Ruth.
Yeah, okay. So regards the coverage for United Healthcare from Johns Hopkins. We received a letter from Johns Hopkins to say that they were not going to honor anything with United Healthcare for the Advantage plan. Is that what your understanding is as well?
Yeah. Can I go back one slide? So yes. This last consumer advisory, which I actually really didn't touch on, policyholders of AARP Medicare supplement plans insured by United Healthcare can receive services from Johns Hopkins. And so, yeah, that's for Medicare supplement specifically. With regards to the Medicare Advantage plans, yeah, it is true that Johns Hopkins hospitals and providers are no longer in network. The reason it's different with the Medicare supplement plans, and that gets complicated. I mean, they don't have a network. The Medicare supplement plans don't use a network. And so that means that if you purchase a Medicare supplement plan, you can go to any hospital, any provider that accepts Medicare that's accepting new patients, essentially. And so that's where we put out that consumer advisory to help Marylanders understand that situation.
Got a letter from Johns Hopkins saying we don't have any agreements with United Healthcare. Please do not come here with United Healthcare insurance.
Right. And the Medicare supplement doesn't.
Yeah. You're saying it's not true for the Medicare supplement plan.
Well, I'm saying that it's not true because that's not how the Medicare supplement plans work.
Okay.
So there are not agreements between that Medicare supplement plans and they don't have a network.
All right,
So-
so when we get people here coming in and saying, I have a Medicare supplement plan that is insured by United Healthcare, can I go to a Johns Hopkins hospital? Is that a yes or no, or?
Yes, yeah. I mean, that's a yes, provided that they're accepting patients. Yes.
Thank you.
Stephanie?
Thanks. Thanks so much for this, all the work that you do and this helpful information. I have heard from a faith leader that one of her congregants thinks she was scammed during Medicare open enrollment, and is calling the SHIP program about that. I saw what I thought was a pretty good video about Medicare fraud by the Comptroller and Department of Aging that I just put in the chat, just to add to the mix. And I had recently heard from my Uber driver, who was an immigrant, that his health insurance wasn't there for him when he needed it. And I talked with him a bit, and I think it was a junk insurance plan. And this was before the changes in eligibility for different immigrant groups for tax credits and Medicaid coming up. So just, I think it's so important, the work that you're doing to tell consumers about the fake health insurance sites and capacity for fraud, because I really think that there are a lot of companies going after people who are feeling especially vulnerable with the loss of tax credits and the loss of access to quality health coverage, that people are trying to jump on them. So thank you for doing everything you can to spread the word and for your presentation today.
Thanks, Stephanie. Does anyone else have any questions? With regards to these advisories, you can find them on our website. Our website is insurance.maryland.gov. If you just search advisories, it'll bring it. It brings the advisory page right up. I think that's the kind of the easiest way to explain how to get there. And if you ever reach out to me, if you ever see something out there that you think it would make sense if the Maryland Insurance Administration put out an advisory, or you're looking for one of our advisories, feel free to reach out.
Thank you so much, Patty.
Thanks, Mark.
This is such important work, and yeah, I'm excited. These are all like really important issues to look into, and thanks for all the work that you do for putting the word out there. Amelia, should be on. Okay, so we'll discuss upcoming federal changes. Again, I think we'll be going back to Johanna to go over these updates.
All right, yeah. So, you hear me?
Yes, we can.
Excellent, thank you. So yes, we've got lots in the pipeline over the next year. As we have discussed already, there's a number, and in past meetings, there's a number of changes under federal law to immigrant eligibility for health coverage, or at least federally financially assisted health coverage. So effective, this was August 25th, but we actually implemented this for disenrolled, I believe, this September, for those individuals who had status. So that was about 300 people who are both, this is the one group that is ineligible both to enroll through Maryland Health Connection now and ineligible for referral. They can still enroll off exchange directly with carriers, but would not receive any financials. Next, we have a group of individuals, about 20,000 individuals who are currently enrolled on Maryland Health Connection, who are legally present non-citizens below 100% of the federal poverty level, who are ineligible for Medicaid, largely because they are still in their 5-year waiting period that applies to them before they can gain Medicaid eligibility. Since the passage of the ACA, people in this reading period seeking Medicaid have been eligible for premium tax credits. But HR 1, the reconciliation bill over the summer, revoked eliminated their eligibility for tax credits. So those individuals have been renewed and have been and again, about 20,000. Oh,
Hey, Johanna,
sorry.
it's getting
Okay.
harder to hear you.
I set it here. Is that it?
You could try turning off the camera. Sometimes that can help too, maybe.
Okay. How's that? Any better? Can you testing
I
1,
think-
2, 3? Can you hear me? Still tricky. Still tricky. Okay. You know what?
Yeah, that was a little
I think
choppy.
Amelia, do you want to take it away here because you know this just as well as I do?
Sure. Yeah, we just have a couple slides. I think we've talked about this information before, but I think in particular, there've been a lot of questions from stakeholders and groups around the state about what are all the different changes to immigrant eligibility, both for Marketplace and Medicaid that are coming down the pike, just because there are so many, and I think they've gotten a little convoluted and people are concerned about coverage and what the status of their coverage is, when are these changes coming into effect. So I think we just wanted to give the SAC a reminder and an overview of what the upcoming changes to immigrant eligibility are. And as Johanna was talking about, I think she overviewed and we could hear the first update, which was already put into place. And I think we all are familiar with that DACA recipients were recently eligible for Marketplace, both enrollment coverage through the Marketplace, as well as eligibility for premium tax credits. That was a November 2024 rule during the Biden administration. That was rescinded, and as of September of 2025, DACA enrollees through Maryland Health Connection were disenrolled. That was the first eligibility change that impacted around 300 enrollees who were currently enrolled and subsequently disenrolled in September of 2025. And then under the federal reconciliation bill, or HR 1, OBA, all the various names for it, the next kind of sweeping rounds of eligibility changes are coming up in the next month and year. So the one I think Johanna stopped on was beginning January 1st, 2026, so starting this upcoming plan year. The definition of lawfully present immigrants for the purpose of Marketplace eligibility and premium tax credit eligibility has changed. So individuals, lawfully present immigrants who are currently eligible for ACA subsidies beginning January 2026, all lawfully present immigrant statuses who have incomes under 100% of the federal poverty level will no longer be eligible for premium tax credit eligibility. They will still be eligible to enroll through the Marketplace, but they will not be eligible for financial assistance. So that's the first big change that's coming around starting January 1st, 2026. That impacts people this open enrollment. So we've been sending out letters, text messages, and notices to these consumers that are impacted by this to let them know that starting next year, they will not continue to be eligible for financial assistance. Again, this is the population that is below 100% of the federal poverty level. So a lot of these individuals are individuals and families who would be eligible for Medicaid except for their immigration status. So we're talking about a lot of individuals who are in that 5-year waiting period for Medicaid that will now lose tax credit eligibility. That impacts around 20,000 individuals who are currently enrolled. So that's a pretty large bucket of our enrollment. The next change, I'll skip to the last one. So just going along with Marketplace provisions. So that's the first Marketplace change. The next one is coming in January 1st of 2027. This one makes a really sweeping change to the definition of lawfully present. So there's dozens of different immigration statuses that are currently eligible for premium tax credit and Marketplace coverage. Starting January 1st, 2027, that list is going to be significantly reduced to 3 groups, which are listed on this slide here. The three statuses that will continue to be eligible for tax credits are lawful permanent residents, Cuban Haitian entrants, and compacted free association migrants. So it's significantly lawfully present individuals who will continue to be eligible for tax credits after January 1st, 2027. With that change, I think we're estimating a similar 20,000 individuals will be impacted by that. So this first change in 2026 is impacting 20,000 enrollees eligible for tax credits. The January 1st, 2027 change will similarly impact an additional 20,000 current enrollees. And then starting October 1st of 2026, the big change to Medicaid eligibility is going into effect. This does a similar thing to what the marketplace provision does. It limits Medicaid eligibility to those three immigration statuses: lawful permanent residents, which we sometimes refer to as green card holders, Cuban Haitian entrants, and compacted free association migrants. So those are all the changes coming down the pike in the next year. With the Medicaid change, I think our Department of Health, who's our Medicaid agency, estimates that around 60,000 individuals will be impacted by that change. So a pretty significant section of our population, of our current enrollees, that I think it's going to be a pretty tough year. I would also note too, so there's a provision in the reconciliation bill with the Medicaid changes. We have a couple programs that extend coverage to pregnant and postpartum individuals and children, regardless of immigration status. Those programs will not be impacted by these changes. So there's a lot of changes to immigration status eligibility and who continues to qualify for Medicaid. But I did want to note that those two programs won't be impacted, and pregnant and postpartum individuals will continue to be Medicaid eligible, regardless of these provisions. Carmen, I think that might have been your question. Just wanted to confirm my answer.
Yeah, it was, and I'm wondering, I'm just sitting here wondering, is there some way that, I don't know if you or somebody can talk to this to our chamber members? I mean, it's not just the members, it's just our community. Can we do something through the chamber where we can facilitate this communication out to the community?
I'm sure we'd be happy to. I think it would also be really helpful to pull in our Department of Health partners, but we could definitely talk online, and I'm sure we'd be happy to coordinate.
It's just there's so much confusion about it, and a lot of people are being left out in the cold, and it's not very healthy. It's not very healthy for any of us, right? That we don't want to have people who are afraid to go take care of themselves because, first of all, they don't have coverage, but secondly, even if they could pay for it, they're afraid to go anywhere.
Yeah, absolutely. I'm happy to follow up offline. We've been doing a lot of presentations. I'm sure we'd be happy to coordinate. Yeah, thanks.
Okay, thank you.
Oh, Stephanie, go ahead.
For immigrants that are rolling off because they're no longer eligible, are there any messaging? Maybe you've already done this with DACA folks, like messaging after they roll off, like where to go, like federally qualified health centers or, legitimate places to get care, so that they're not just getting messages from like junk insurance companies that are targeting them.
Carmen, it's Susan.
Sorry.
I just want.
Okay, be quiet. Sorry.
Stephanie, that's a good question. I don't know if we have anyone on our marketing team who could talk to that more. I know we've had those conversations before. I'm not sure where it stands in terms of communication, but that's a great question. And if someone is not on the call who could speak to that more, I can follow up more with this group afterwards and give an overview if we've incorporated some of that communication.
So can you please repeat that question for me? What was the question?
Yeah, so I was wondering for immigrants who are rolling off coverage because they're not eligible for the tax credits anymore, if there's any messaging going out to them about legitimate places to get care, like federally qualified health centers, just because I think maybe there are companies like junk insurance companies that are targeting vulnerable folks, and any information about where they can legitimately get care could be helpful.
Yes, we have been in contact, in providing information to where they can go to. But let me take that to our team and see if we can have maybe some, we do have some fact sheets, but something else that might be helpful. And we're more than happy to attend the chamber group. Carmen, you had mentioned getting together. We're happy to work with Amelia to attend and provide resources as well to your group.
That would be awesome. Thank you. I just want to mention to Stephanie, because you said federally acceptable clinics, and that kind of throws me a little bit, because I know, for example, in Montgomery County, we have health clinics that are from Primary Care Coalition, that have health clinics that you don't have to be covered by anybody in particular, but it's a sliding scale. So I know that there's county approved and sponsored, and there's probably Maryland approved and sponsored health clinics. I don't know, or maybe it's just different counties have different things. But it wouldn't be a federally approved thing. It would probably be more on the state and local level, I would think. So where do you go and get that information? That would be nice to have a centralized information, right? But I don't know if that would make us target to federal people who might want to go there and see if we can find somebody else, right? So I don't know how, trying to be delicate about this. I don't know how that would, how would we communicate? I think we maybe communicate that at the local level.
Yeah. Oh, those are great points. And I Primary Care Coalition is great. So federally qualified health centers, and then any other health clinics that serve, underserved communities, I think are great. I see in the chat that Johanna said that for immigrants losing APTC in January, we did send an email informing them about FQHCs and hospital financial assistance programs. That's great. And I guess, those kinds of programs can help not just these immigrants rolling off, but anyone rolling off of health coverage. So maybe if messaging doesn't specifically say the word immigrant on it, maybe that takes some of the pressure off of eyes looking at everything that go out, and is still helpful to a broad category of people.
Okay. On the federal changes, is it a federal change? I might have asked this question in the previous meeting. I've just been perplexed by the fact that when people go into a hospital, they're being asked if they're U.S. citizens or not. And I'm wondering if this is a sort of a mandate from the federal sector, if anybody knows that. I guess not.
Is this an observation?
Sure.
I'm not familiar with.
Okay, so people going to a hospital and they're going to an emergency room or something, and one of the questions has been added to the forms, and this has happened both at Georgetown Hospital that I know of and Holy Cross that I know of, that they're being asked if they're a U.S. citizen. And I didn't know if this was a federally mandated thing, or if it's, or if it's just some hospitals decided to ask that question. Are hospitals asked to report back on the status of the people that come into their emergency rooms?
I know we had someone from the Maryland Hospital Association on the call earlier, but it looks like he's hopped off. I'm not familiar, but again, we could do a check on any changes in that arena. I'm not personally aware of any changes in that realm.
Okay.
But it's bringing that up as an observation, something we could definitely look into more.
Yeah, thanks for bringing that up, because I know in the past MHA, before this federal administration said that they don't ask that question, that their hospitals do not ask that question. So I think it's really important that you just raised up that you've heard of a Maryland hospital asking it.
Right. Okay.
I have a quick question, lady from Casa. Do you have an estimate of how many people will be affected by the third change in 2027 when everyone is going to be losing credit? Do you have an estimate?
Yeah, for the January 1st, 2027 change, just the broad change to lawfully present, that's impacting individuals at incomes 100% of the federal poverty level and higher. So the 2026 change is just for individuals below 100% FPL. That's impacting 20,000 consumers. And then similarly, the 2027 change, that's impacting all consumers at incomes above 100%. That's an additional, we're estimating 20,000 individuals who will be impacted by that. Similar to the 2026 change. So in total with those two changes, it's a group of 40,000 current enrollees who are impacted, and 20,000 respectively for each of the two changes in 2026 and then 2027.
Plus the 60K that you spoke about on the changes of October 1st, 2020.
Yeah, Medicaid. Yeah.
So we're talking about 100K.
I think it's around 100,000 in total.
Okay.
Yeah.
Here.
Thanks for the questions. I think, yeah, we just had one more slide that we wanted to put in. I'm not sure if we've gone through the Medicaid changes as much, but I'll just wanted to give a brief overview. In addition to all these eligibility changes for immigrants in the next year, we've been working very closely with the Maryland Department of Health because the federal reconciliation bill also made a lot of sweeping changes to Medicaid eligibility and systems changes to how the Medicaid program operates, many of which fall under our jurisdiction because we have an integrated enrollment system with our Medicaid agency. So the Maryland Health Connection portal processes the majority of Medicaid enrollments in the state. So these are other pretty large Medicaid changes that I think you guys are probably familiar with, some that are going to significantly impact MHBE operations in the next year as well. And we've been working on implementation plans for all of these too. So I'll just go over them really quickly. The first one is what we had just discussed on the last slide, the change to immigrant eligibility effective for Medicaid, effective October 1st of 2026. There's another change to Medicaid coverage that doesn't change eligibility for any populations, but it just adjusts the retroactive coverage period for consumers. So as it currently stands, a consumer can get up to 3 months of retroactive coverage, Medicaid coverage. Starting in January of 2027, retroactive coverage periods are shortened for all populations. So we have our Medicaid expansion population, which is those adults 19 to 64, above 100% of the federal poverty level. So between 100 and 138% of the federal poverty level is our ACA adult expansion group. Their retroactive coverage is reduced to just 1 month, and then all other Medicaid enrollees' retroactive coverage is reduced to 2 months instead of previously and currently, which is 3 months. That's not a huge operational burden, but it is an impact on consumers who are going to have less access to retroactive care, coverage for care. The last two provisions are the kind of big changes that we're really focusing on. The first one is increasing the frequency of redeterminations for Medicaid eligibility. So currently, Medicaid consumers are determined eligible and then are redetermined every 12 months. So they have a year of continuous coverage and then have to go through the redetermination process every 12 months. A big change in the federal reconciliation bill is increasing redeterminations to at minimum every 6 months. So we're going to go from redetermining eligibility every 12 months to every 6 months. And this is just impacting the ACA adult expansion population. So those adults 19 to 64 that are covered under Medicaid expansion. And that constitutes around 330,000 individuals in total of all of our Medicaid enrollees. So in the state, we have about 1.4 million Medicaid enrollees and 330,000. Those are going to be subject to increased redeterminations. That's going to create an administrative burden both on consumers and the exchange, operational burdens. It's going to cost the state a lot more, and it's hopefully not going to create so much of a burden that it reduces enrollment, but it definitely is it's a burden on consumers. And then the last one I think that we're all familiar with is the mandatory work requirements. So these are what we've really been focused on working with the Department of Health on to implement. Essentially what they do is set mandatory requirements for all ACA expansion adults, work requirements of a minimum of 80 hours a week or something equivalent. There's a lot of exemptions to this. If you're a student, medically frail, a lot of different exemptions to the Medicaid work requirements, but it's a very convoluted provision to implement. It's going to significantly increase the administrative burdens on consumers as well. And it's operationally going to take a lot of work on the part of the Department of Health and the exchange to operationalize over the next year. So we've been having conversations with the Department of Health on the implementation of Medicaid work requirements. All those go into effect January 1st, 2027, and we are deep in the planning process of that. So just wanted to give an overview of all the Medicaid changes that are impacting the MHBE as well. And Carmen, I think you have your hand up.
Yeah. So does it on the mandating work requirements verification, are people over 70 years of age exempt from this, or any kind of age around that time, 68 or 72 or 75? Is there an age exemption? I know a number of people who have in our community that are on Medicaid and Medicare, and I'm wondering if this applies to them as well, the older population.
It does not. It only applies to the ACA expansion population, which does not include dual Medicare and Medicaid enrollees. So anyone that's aged into Medicare, this provision does not apply.
Okay, thank you.
And then I think we just wanted to round out this meeting, open it up for a discussion, especially given all of the eligibility changes that we walked through, and considering that a lot of these changes are coming up starting January 1st of this coming year, and then throughout 2026. We've obviously employed a lot of communications through our marketing team, are continuing to do so, but it is a lot of changes coming up. I think one of our particular concerns is just wanting to balance making sure that consumers have the information that they need, understand the coverage changes, but also not scare consumers and not provide information too early. You know, for changes coming in 2027, we're not necessarily publishing consumer-facing information just because we don't want to give we don't want to put too much information into the hands of consumers without, we want to create a balance of the information we're providing, but also making sure that consumers have the information that they need. So we always welcome SAC input, but in particular on this subject, in the time that we have left, would love to hear from stakeholders. If you have any other thoughts on strategies for engaging with affected populations, suggestions for communications to specific groups. So I'll open the floor up.
Well, I think I mentioned, I think that we'd love to do a discussion, and maybe several discussion roundtables with affected populations. But I wanted to ask a question, if I may, and which is not a strategy, but is just trying to clarify with the families where the single parent that got left without a job because their spouse was deported, and they were just taking care of the kids. The kids are born here. They would qualify for Medicaid, but then somebody has to be responsible for them. Would the parent that stayed here have to qualify, or how does that work? What, I know we said that they would still be qualified to go and to the portal and get health insurance, but how would they qualify for Medicaid? Well, if you have like this one family has children ages 8 to 14, they have 4 kids, and the mom was raising them, and then suddenly the dad was taken away. So how would they be able to get health insurance?
And how would the 14-year-old?
Yeah, how would they get Medicaid? How would they get Medicaid?
Yeah, good question. I mean, they still need a guardian. So they would, either a parent or a guardian would have to serve as the applicant enrolling the child, but the process would be the same as if it were adult enrolling, receive the necessary information about the child, but they'd have to have a parent or guardian on the application, is my understanding.
So if the parent is undocumented, would they have to go find somebody else to do the guardianship, or what?
No, no information is asked about the parent or guardian. So it's only the child's information who we're determining eligibility for Medicaid for. So the parent or the guardian, regardless of their immigration status, would not have to provide any information for themselves if they are not the ones enrolling in coverage. If it's just the child, then it's just information about the child as the consumer for Medicaid.
Okay, thank you.
Good question. Thank you.
So as far as strategies, I think we should get together some of the organizations in the area that deal with impacted populations and come up with a strategy working with the Health Benefit Exchange on how to do this. I mean, lady, I don't know what you think, but I know, for example, Identity is working with a lot of families that are impacted. We're at the chamber, we have a foundation. We've been working with a lot of families impacted. I know CASA is. And so I don't know, maybe what we do is we follow up with you guys, with Teresa and Amelia and Lady, and maybe Diego from Identity, and some of the other organizations that are around Maryland. I know in Montgomery County we have quite a few, but maybe what we need to do is a round table to start off with MHBE, and see with the Maryland Health Connections, and see and come up with a strategy that is just not it's not siloed to a particular slice of the population, but we all come together for the entire population as a whole and come up with a strategy, whether that is some I know this impacts not just Hispanic population, it impacts everybody, right? It just impacts the people who are economically disadvantaged. So there's a lot of inputs, like Interfaith Works comes to mind as another organization that works here with all kinds of people, not just immigrants. And I think that finding the media outlets that reach our populations, whether it's radio or TV or something like that, maybe a marketing strategy, maybe Teresa, you might have some ideas, but also some forums that we can put together that are focused on this throughout Maryland. I don't know, that's some of the things that I could think of getting the leadership together, coming up with a representative group that's not too unwieldy on the leadership for this impacted populations. And then coming up with both a media strategy and an in-person kind of thing, because some of it is then they don't know who to reach out to, right? They don't know where to ask the questions. So anyhow, that's my thought.
Thank you. Yes, and I appreciate what you just mentioned about communication. Part of what CASA is currently doing, it's providing workshops, virtual workshops, as we notice the community are not showing up to any in-person events, and even for health fairs that we have had in the past, they're not showing up because of fairness of ICE activity. As you meant, as you probably know, this is pretty much a crisis right now for the immigrant community. And now we're adding to the conversations the public charge. And I don't know if it will be a good moment also to try to inform communities about what public charge means in reality and how this might not impact them directly, but it's just a strategy, a technique to keep them away from getting all of those benefits that they need and deserve. So part of the strategy that we're planning as well, including in those know your rights, it's including a piece for public benefits, how these impacts are gonna affect their families and eligibility, because we have mixed families. The children are US citizens, but parents are TPS holders. And also now a big campaign about educating the community on these public charge that is not implemented, but they're gonna bring a lot of fear on our community to enroll in different programs because of this. And ACA is included in the language for the public charge new rules.
Right. And then I also think that part of, you're right, lady. And then, so I think we should begin by having some of us together with Teresa and Amelia and whoever else you think should be part of this, Stephanie, I don't know. And then let's have a preliminary thing and come up with a list that really covers the state, right, on this. Some of the people, it comes to mind that people like Anise Cody from now she's in the Primary Care Coalition, and some of the other people that are not necessarily Hispanic, they're, we have a big Ethiopian population that's impacted, for example. There's other people that are being impacted. People from here that just, I know people who are born raised here that just are in very difficult situations, that the Medicaid thing has impacted them. So maybe come up, do a preliminary talk, sort of facilitate a discussion of who would be the leaders that we wanted to have around the table to have a strategy discussion about this. Or we can start with a small group, but I think we need to look in a broader sense. I don't know. What do you think? That's just some of my thoughts.
Thank you, Carmen. I do appreciate your thoughts. And yes, I think that we can have a bigger discussion as moving forward. I'll talk with our team, talk to leadership, and see what can be done as far as planning a meeting and having a strategy. I do know that we work closely with the immigrant community when it comes to when they need assistance. We try to give them direction on what to do, but I agree. I'll go back and talk to our team and find what we need to do to pull this together and be in touch with you and with Lydia and from CASA. So thank you very much for your thoughts and your input, and anyone else on this call that's interested in attending.
Thank you.
Yeah, thank you both for I really appreciate your thoughts and input. I know it's a difficult topic, but we really do appreciate stakeholder feedback, and I think that this was a really helpful conversation. We do have a few minutes, so if any other members still on the call have any additional thoughts.
I think it was just a very thought-provoking conversation. Everybody's deep in thought. Thank you, Teresa.
Well, hearing no other comments, I think maybe Stephanie or Mark, you can go ahead and wrap up the meeting.
Should we open up for public comment? All right, well, while people are thinking, I will make one comment that I was hesitating to say because we're still in open enrollment, but thinking past open enrollment, our organization, Maryland Healthcare for All, is working on radio and digital ads about the Easy Enrollment Program to help people enroll in health coverage by checking a box on their state tax return. So just as a heads up that that's something that we're going to be doing in January, but all the focus is on open enrollment right now. So just a sneak preview about that.
Nice. I like that. I like that. That's a good thing.
And thank you, Stephanie, for partnering with us. You guys are fantastic. Thank you.
Thank you. Well, you guys are fantastic. Love working together.
Well, I'm going to miss you guys as I'm rolling off. So hope we stay in touch. Hope we stay in touch.
Yeah.
Yeah, thank you so much, Carmen. Your
Okay.
voice is so appreciated here.
Okay. December, since there's everybody's quiet, December 15th, we have our minority legislative breakfast. And it's going to be at the Bethesda Hyatt. And I'm hoping to see you there again. So I look out for my email on that if you haven't already seen it or responded to it. So I think if there are words that you want me to check, because this year I'm in charge of putting some of the words together and giving it to our other organizations that are looking at it and see. I'm collecting feedback from people on what we should tell our legislators that is important to our minority community. So if you want to send me emails that have some words, like 3 or 4 lines about we should ask for this, that would be helpful. Okay. And I'll also I'm on, I don't know if you knew this, but I'm on the Trinity Health System board on the Holy Cross, if that's helpful in any way.
Thank you, Carmen. I do know that Michelle Eberly will be attending, and Johanna, Baby, and Marks will be there as well.
Okay.
I believe our new small business outreach manager will be there. His name is Jose Cabrera. You'll have a chance to meet him.
Oh, that would be fantastic. Thank you.
Yes, you're welcome.
Well, great hearing no other public comments or other comments from the SAC. I think we can end this meeting. I'll just say it's been great serving here as a co-chair, and keep in touch with all of you for sure.
Thank you.
Thank you.
Thank you, Mark. Thanks, everyone.
Thank you. Bye-bye.